Our next discussion is really addressed to Dr. Francine Darroch, who will lead the discussion. Are community-driven models more effective than institution-led approaches in promoting long-term mental health outcomes through physical activity? Francine, the question is up to you. You have to help us find an answer. Okay.
I don't have a team of support up here. I feel anybody want to come sit? Yeah. Well, I think I mentioned in my presentation earlier, typically in the work I do, I would always have folks from the community that I'm doing the work present with me. Sometimes it's not logistically possible, like coming to the US at this point. But we do have a documentary that was made based on some of the programming. So it's 11 minutes long, and I'm hoping that maybe we can start with that and then kind of open the floor to questions and discussions. So a couple quick things I want to highlight about this is I'm going to feel really awkward sitting up here watching myself talk on the screen. That's the first acknowledgement I want to make. But the other one is that we have 3 programs. So when we talk about doing trauma and violence informed physical activity, we don't call it that. Nobody in the community would come. If we advertised it, people would feel sort of stigmatized or, oh, so and so's going to that program. So what we do is we develop names for the programming with the participants. So we have the 3 programs I mentioned earlier, and they're called Moms in Motion, Healthy Hustle, and Empowered Women's Movement of Banff Ledbury. So these are the 3 programs that you will hear about. So I'm going to hopefully let this mini documentary take it away.
Just through coming, like, I don't know when it happened, but it happened, and I rarely feel anxious now. And I just feel so much more confident. And um, yeah, it's really made a big difference in my life.
Physical activity has been identified as a key public health priority to improve mental health and to prevent, chronic diseases. However, what we know is that physical activity is not accessible for everyone. There are certain groups and populations that are excluded from programming and different types of interventions. Women suffer from twice the rate of depression compared to male counterparts. And when we look further into issues such as gender based violence, we know globally that 1 in 3 females will experience gender based violence in their lifetime. So, when we think about access to physical activity, we know that it's not equal for everybody. In a lot of equity owed communities, there's major barriers, the cost of programming, transportation to and from programming, and often things that we're not thinking about is childcare for programming, and the different sort of essentials that people need to take part in physical activity. So when we take a trauma and violence informed approach, we're really taking an equity oriented approach to program delivery, thinking about the individuals that are attending our programming, what their lived experience may be, and delivering programming in a way that works for them. For our research, we partnered and launched with 3 equity owed communities in Canada. We have the Banff Ledbury community in Ottawa, we have St. Mary's Home in Vanier, and we have Crabtree Corner, which is in the downtown east side of Vancouver.
Last year at this time of the year, I was depressed. I was going through postpartum depression. I was alone. I was with a baby. I had heartbroken, single mom for the first time. When I started Moms in Motion, we started by going to the parks. Love that. It relieved me. Started becoming interested. And I love the boxing and the dancing. And now the yoga.
Maman au mouvement, c'est différent parce que là, on est réunis tout ensemble, les mamans qui viennent d'accoucher, celles qui sont enceintes. Avant de faire l'activité, on dit un peu ce que nous, on ressent, ce qu'on veut faire. Comme l'autre fois, on avait de mal au dos et on a fait du physique par rapport à notre situation.
It was all our ideas. It was all about us. It was what we wanted. It was what we needed. And it was what we felt would make it accessible to us. It broke down those barriers that we all face every day. And I think that's essentially what made the program work, was that it was all about us, and we had a say in what we wanted to do, and we had a say in what made it easy. And that's what made it work.
A depressed mom will lead to a depressed child. And then if we can have our own space to breathe and be ourselves, that would help in our daily lives. It's like you start fresh.
Barriers to participating in physical activity are numerous, especially for women and women who are parenting, and especially in this community, the downtown east side. A lot of the places that do offer physical activity programming are like by membership where you need to pay, or there's not childcare available. And also just there's a lot of fear of accessing new spaces.
We're all practicing together. So we're all enjoying dance together or yoga together. We get input from the community. What would you like to do? What would you like to see more of? So it engages a conversation with them and they feel that they have each other in a sense of autonomy in their practice and togetherness. It's offering them an accessible, sort of invitational environment to be together in. They feel safe. They're in an environment which is always the same. There are no big changes. They know what they're coming into. There's childcare provided, and it's very accessible to any self-identifying woman.
Knowing I had a place to go, that I was accepted, judgment free, and no matter how crappy I looked, nobody commented on it. And no matter how badly I was dancing or how bad I was doing in whatever fitness activity we were doing, nobody commented. They were just like, "You're doing so good. Keep going." So yeah, that was always having like a positive place to go weekly. It was really nice.
I think that the way that this program is structured it's the informal nature of it, of just coming together, having a set time to meet every week, knowing that people are going to be there when you show up, engaging in physical activity with other moms, other people that are dealing with similar circumstances in their life, helped create a sense of community within the group.
So we had over 250 individuals take part in our programming. And of those, we had 168 people take part in the research. It was optional to take part in the research component of this work. We wanted to ensure people, really had a choice to participate or not. Across sites, participants ranged from 17 to 79 years old, and we had a diversity of cultural and educational backgrounds. But one of the things we found was that there were a lot of challenges with mental health, particularly related to anxiety and depression.
So when we're talking about physical activity, it doesn't need to be a huge amount of activity for us to reap the benefits. So you can do as little as 10 to 15-minute bouts of activity have shown to have meaningful changes in mental health outcomes. And it's often where we see the greatest benefit is when we get people who are doing no activity whatsoever to doing something.
So when we asked participants about the impact of the program, 95% reported improved quality of life and mental health.
My mental health changing has also changed my quality of life. Like it feels like I'm living in the same place, doing similar things, and yet I feel like my quality of life is so much better.
We've been really fortunate to receive funding from Public Health Agency of Canada and other organizations to do this work. So we've been able to test and refine our intervention. But we really struggle when funding cycles end. This often leads to communities not being able to continue programming due to a lack of financial resources, which either leads to, pauses in programming or, worst case scenario, cancellations. I think the key to our programming is the consistency and knowing that they can show up each week and have that support and move in a way that feels good for them, but know that they have a community of people around them.
Going and feeling like I can do this, all of a sudden I can move. I used to feel like I couldn't move, because I was in pain and it was so hard.
I've struggled a lot in my life. I've come from, being a young mom at 15 years old. I've gone through addiction. There've been parts of my life where I felt like I had nobody and nothing. And having programs like this changes that feeling. These are things that are like deeply ingrained in me. And the Healthy Hustle, just like it provides such a safe, open-minded, healthy place to be that I can't imagine my life without it.
So there is another thing we called like an old thing. The good mind, the good brain mind is in the good body. So if you move your body, that means your mental health is good. Is it important to continue? Yes, 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 yes. Like with us, as I said, it's the only program for moms, and we feel humans. We recharge our bodies from, like, we disconnect from the outside and recharge ourselves so we can continue the fight for ourselves, for our families, for the moving on, for the next week.
Well, the question is, what's next? How is this going to go on, and what's going to happen when your funding run out?
That's a great question. So we are currently, like many people in this room, we are always hustling to try and find additional funding. We are currently doing some fidelity sort of checking on our program. So as I mentioned in my presentation, we were able to secure an additional year of funding for each site. So the programming is continuing. And the research team is sort of, stepping back a bit to allow the community to take charge and run the programming. So we're currently doing evaluation around that and sustainability. We've also tried to map out the costs of it. So we're working with an economist at Carleton University to sort of look at the cost benefit analysis, which is very challenging to do, but we've sort of developed a model where here's what we could do if we had X amount of funding, and if we don't have funding, what's a bare bones program that we can run to keep this going.
Well, I'm going to play a devil's advocate here. How much of the benefit and the empowerment that this individuals on your video have actually shared with us is really driven by physical activity, or how much of it is driven by the fact that they have this now community of people that they get together with, and they're chatting and they're talking about their issues, and they feel empowered by the fact that their problem is not only shared, it's not only theirs, but others. So where does exercise fit in this equation? Oh, where physical activity, exercise, physical activity.
Yeah, so I would say that I don't know if it matters. I think physical activity is the conduit to bring people together, and I think the social connections are what keeps them there. So if it was me turning up to run programming every week and there was no conversation, or if we were delivering it remotely, via video or something, it wouldn't work. So I think what our research has shown qualitatively is that the social connections are huge. So we're delivering programming in communities, as I mentioned, that do not have existing programs. And we're all of a sudden creating a sense of community, or not we, I don't want to take responsibility for that. The women who are attending are creating that sense of community and that safe space that they want to come back to every week. So I don't know if I avoided your question there.
Yeah, I think that having both definitely, and then the fact that physical activity is what's bringing them together is key. How much of the program that you did, and I'm sorry if I actually missed that, focus on other aspects in terms of lifestyle of their life?
Yeah, so the main focus for us, given the diversity of the sites, so some of the sites, participants are mandated to go to certain types of programming. So parenting programming, maybe some anger management, emotional regulation type programming. So for us, the sole purpose was just to be delivering physical activity and creating that environment where people could come and share a space with people who have similar lived experience. So I think we never ask for disclosures of trauma and violence. We, as part of mandated through the funding that we had, we did have to ask about experience of violence, but people were able to skip that question if they didn't feel comfortable, which a lot of people did. So I think for us, it was really, sort of back to your earlier question, it was about the physical activity, but knowing that those social connections and that co-regulation was happening with their peers.
I spent a little bit of time in Northwestern Territories, in Washington State, and been to Vancouver and visited some of the communities out there, and got to learn that enormous problems with addiction, alcohol, and suicide. In fact, the day that our boat landed in Alert Bay, we were told that the day before that, a 14-year-old killed himself. So, how much of this still exists in the Native community in Ottawa, and what are you doing about it?
Yeah, that's a huge question. So rates of suicide are higher among Indigenous communities in Canada. I think in terms of what we're doing about it, I think we're trying to take a bit more of like an upstream approach of the work that we do is somewhat preventative, right? Even though folks are already experiencing a lot of these inequities, the goal is more around creating community. I think a whole other part, that I touched on very briefly is the advocacy around it. So we do have our partnership is with the Aboriginal Infant Development Program in Vancouver. So we do have a lot of components of what we call cultural safety built into the program. And some of the activities are, we've done powwow dance as part of the physical activity that happens. I think.
Any questions? Yeah.
Should I run?
Is that microphone working out there?
Okay, now it is. Francine, I loved the video. And so I was just curious from the feedback that you're getting from the people who are participating, if you could point out some of the things that you think the program does really well, like the things people like and the things that you do to kind of make the positive things happen or facilitate the positive things happening. Thanks.
Yeah, thanks. That's a great question, Michelle. I would say what people like about the program is that it's responsive to their needs. So if we, deliver a class or we have an instructor come in and there's concerns around maybe the language that's used or something that happened, I think that community members feel very comfortable coming to us and having conversations about that and then seeing how responsive we are. I think even in terms of the type of activities that are chosen, logistically, we have to book a few months in advance to get people, to be able to come at the time set. But I think people really appreciate that there's choice in activities. So there's some participants who love, non-contact boxing, and other people that feel like that's too violent. And so they can come to, unfortunately, sometimes people won't come to a 6-week program if it's an activity they're not interested in, but they'll know that the next round of programming, would be something that they will enjoy. So I think being responsive to community, I think hiring folks, and using, a lot of the community members to sort of lead and support programming as peer leaders within. And I think ultimately just sort of the commitment to the community. So the Vancouver Downtown East Side site, we've been doing work there for almost a decade now. So it's, I think, just sort of that long-term trust that has been built really supports ongoing work.
Thanks, Francine. I mean, that's an amazing program. Congratulations. That video is incredible. My question is just about navigating research partnerships with community-based organizations. It was inspiring that you're saying that first and foremost, it's a program people can come and the research is optional. I think there's probably a lot of people here that are running programs that may be interested in partnering with universities, and if you can comment on that at all.
Yeah, that's a great question. So I think researchers are always looking for partnerships to do this type of work. And I know in the context of the university I'm at, we are very focused on doing community-based research as a whole. So we actually have a program set up where it brings community organizations in with researchers to try and pair them up for, appropriate research projects. But to your point, I think it can be really challenging as a community organization to find somebody to come in to do research. My advice would be to reach out to people that you're interested in working with. And I think navigating those partnerships is a whole, careful area of sort of negotiation and having really clear and transparent expectations and outcomes. I sort of cold called from Vancouver, I moved to Ottawa, and I cold called a couple organizations and said, hey, this is kind of what we do in Vancouver. And some people did not call me back or engage at all, which is fair. But others who were similar type organizations were like, oh, this does look interesting. And so we were able to provide, some resources or some outcomes from the other partners. So I don't know if I answered your question fully, but thanks.
Thank you so much. The video was amazing, and also the fact that it shows it's a no-brainer. Healthy citizen is a healthy community. As a community psychologist, prior to becoming a therapist, one of the things I got tired of is the on-off switch, where there's a psychiatrist in the field doing something for 2-3 years, the program would just dry out. And so we went a private route to open up an all-women's gym. And what we discovered is that within those communities that have been deprived of wellness in the system, where they want to work out with only women or whatnot, there's a lot of wealthier folks. So we're going the other route, where we're getting those memberships, and our hope is to using the private sector to pump and invest and to help the community. And as a community psychologist, we did many different things, and the money kept, running out. But what I appreciate about you is that you're so in tune and so embedded, and that you are doing the work and you see the results. And my only hope is, and you're bringing everybody in, researchers or whoever, getting that buy-in. My only hope is that this continues, and someone like you is needed 10 times over. So thanks.
Thank you. That's so kind. And I just want to note that the work that you're doing is so crucial. Like it's such a game changer.
Let's see if this thing not working. What? Good. Okay. All right. You know what? I just want to ask you a question about your study, and I don't know, maybe I missed that, but I saw the age group that you had was fairly wide, 17 to 74, I think, or something like that. Were there any difference in the outcome based on the age group? Were the younger ones more responsive and have more benefit than, I mean, were there any age and then sex difference? I noticed that there's not a lot of men in your study.
Yeah, so we didn't have any male participants. The funding, that source that we
Solely
had,
women. Yeah, you're right.
yeah, solely for women. We haven't disaggregated the data by age, and I think we had, I said it was 17 to 77. We had one 77-year-old, but the mean age, the bulk of folks were all around 34, 35 years old. So that's something, I mean, we're still looking at. We have so much data, so we're still really parsing all of that out.
So you're not sure what, whether or not the younger people benefited more or less or
No.
anything like that. Awesome. All right. Well, think unless there's any other questions. Oh, I see Jacob.
So one question, and I think it goes back to one of the things that I was saying earlier. Do you think it's the exercise that's doing it? And I've always wanted to think about, like, could we create a separate social program that is the exact same for these people that doesn't have the exercise? And would we be getting the same thing? So I'm thinking, like, what if you had the same groups of people coming in and playing bridge or crafting or doing something else? And do you think, based upon the way that people have responded, that you would still be seeing a different result? And can you talk a little bit about that?
Yeah, that's a great question. I do think we need alternative programs, right? Because some people are just not going to come to a physical activity program. And we've actually been told that in the community. Can we do some, an arts-based program? Can we do, games-based? I do think bringing people together and creating a sense of community is going to have a positive impact on, across the board. I think in terms of the physical activity, there's additional benefits that you wouldn't see if you were, we saw the plethora of research this morning that folks have shared with all of those benefits. So do I think we need all, yeah, I think we need to have both. I don't think it doesn't have to be one or the other. I think it can be an and. Yes. About that part. Yeah, I mean, I think you were asking about the goals about the boxing specifically so boxing and actually self-defense was something that came up that people wanted to try. So boxing, we had to specify that it would be non-contact. As I mentioned, some people felt like it was too violent. People loved it. It was one of our most popular programs and where most people attended. I will make a brief note about the self-defense. We tried self-defense not as part of this project, but an earlier one. And it was a disaster. It was very triggering for so many people. We had to bring the women back to the organization, our partner site, and there's a counselor on site there. And I think a lot of it was to do with the delivery of programming. One person asked, okay, if somebody has their arms, on my neck, what do I do? And the instructor said, well, why would they do that? And it was more the way in which it was delivered. And I've talked to other people who do similar programming and they've had trouble with self-defense because I think it's something women feel they need, but it's very challenging to deliver because it's obviously very triggering for most people.
Yeah. Thank you so much. Thank you so much, Francine.